Season here. So I'm a regular person just like you guys, and you are probably preparing for your family, as am I, but we still have to remember our NCLEX goals. So this is Friday, so we do this little thing called Let's Talk NCLEX. I love it, I love it, I love it. It's Friday. Let's get NCLEXing. And if you guys are joining us for the first time, I'd like to welcome you. My name is Regina Callion, and I have the pleasure of being the #1 NCLEX instructor in the world right here at a Remar Review. Happy holidays, everybody. I am actually waiting. I'm actually waiting for my family and friends to come as we prepare to celebrate the Christmas season here. I don't know what you all are doing. I love to know. But I said I'm on the Remar nurses about putting their goals first and making NCLEX a priority. So even though I'm super excited to see my brother and his family and, just enjoy the blessings, I have to remember that at the end of it all, there is a goal that we are trying to accomplish. Hi, guys, I'm Regina Callion. There's a goal that we're trying to accomplish, and that is passing our NCLEX. Yes, passing our NCLEX. So we're going to get started. We're going to get started right now. Thank you. Thank you, guys. The website, if you have questions or comments, always, if you want to know more about what Remar Review is, how we're helping nurses every day succeed, what products are going to be best for you, I have to tell you about the website. It's remarreview.com. I'm sorry, it's remarnurse.com. We made the transition. Sorry for some of you, because honestly, Remar Nurse has taken on this wonderful network and this wonderful community where not only are we helping nursing students, but actually when our nursing students get their license, they come back and they connect with those who are studying right now. So remarnurse.com is just the growth of Remar Review. So that's the website. All right. All of our testimonials, I'm sure that we will even get one today. Because we always do. But we love to hear your story. So I tell you guys, when you pass NCLEX, send in that video and let us know how you have done this amazing thing called getting your nursing license, because it is life-changing. And one of the things about the Remar nurses, thank you everybody who are just joining in, who are taking breaks from work. One of the things about the Remar nurses, it's just that we come from such a diverse array of experiences and cultures. And so with that comes many different inspiring stories of people who have just overcome amazing things. You guys are such a motivation to me that I have no excuses not to achieve my goals, because you guys are overcoming health challenges, relationship issues, financial struggles, and you're still pushing towards that desire, that calling to the field of nursing. And so it is extremely motivating when we can actually see a video testimonial of a nursing student who's saying, I was in your shoes, but I did the Remar 6-week challenge, and now I have my license. And so we always say, pass NCLEX, tell your story, because really it is the best way for you to inspire someone else. And which really, if you think about the culture of nursing, the entry-level positions are sometimes so challenging for new nurses to get a job and to go into this totally different culture where, to be honest, it's not very friendly. And sometimes you are ostracized. Sometimes if you don't fit the culture of the nursing unit, you feel alone. And so when you can reach out, or you can hear experiences and you can make that transition smoothly, it makes a much better experience as a new nurse. And I'm talking about a new nurse who is under 2 years old, honestly, if you have been practicing less than 2 years, I consider you to be a new nurse. So that's just my history. Okay, so do we have any testimonials that I missed? I'm just checking. Oh, there he is. Livy, I knew it. I'm seeing the congratulations. Hi, Rima. Hi, Regina. I passed my NCLEX 8 years since I graduated. Woo! I am now USRN. I will email you my video later. Wow. 8 years. Wow. Amazing. I mean, and that's just what I'm talking about. Like literally somebody who has been out of school for 8 years and able to connect with the REMAR community, get the resources and pass their exam. And you said a RN. Oh, there's so many different, this is just an amazing testimony because let me just say this. There are people who are really emailing about the changes and really just worried about the changes for the RN exam and the changes. And Regina, tell me about the changes and how can I prepare for the changes? But honestly, nursing, the foundation of nursing is set. The human body, the DNA, the structure, the diseases, these are set things. And so it doesn't matter how long you've been out of school. If it's 8 months or 8 years, if you get certain principles down, you're able to pass this NCLEX. And is it a hard test? Absolutely. NCLEX is an extremely difficult test. It takes a lot of courage. It takes a lot of sacrifices to prepare for it. But if you get that information down, it will be so much better. It will be so much easier for you to demonstrate competency, demonstrate that you can be safe, And so, okay. Ivana, hi, Regina. I passed NCLEX earlier this week. I graduated back in 2015, and thanks to you, I am an RN. Thank you so much. You are the best. Ivana, Merry Christmas to you and your license. Wow. Merry Christmas to you and your license. I see an interesting question. Mr. Tyrell, what makes your review different from other reviews? How can you help someone like me who graduated 6 years ago and tested 5 times and failed? That's a good question. I would say when people ask me what makes REMAR different, honestly, is myself. And this is the thing about REMAR. When I first created the program, and a lot of you may not know me, but I come from a background where I didn't grow up privileged, okay, by any means. So just me being here should be a testimony. But this is the thing. I grew up with a single mom. My dad was not in my life. And I had 2 very important grandparents who were very special to me. And when they got older, we didn't have the money to put them in assisted living or in a nursing home. So my brother and I, we had the responsibility of actually caring for them. And I mean, these were sick individuals. My grandmother had uncontrolled diabetes. She lost her vision. She lost both of her legs, like bilateral below the knee amputee. So she was total care. And my grandfather, he had a stroke when I was 15 years old. He had a stroke and he lost his ability to swallow, speak. I mean, he couldn't walk. He was bed bound. And so after school, when I got dropped off from cheerleading practice, it was my responsibility to care for them. And a lot of people would think, wow, like a 16-year-old caring for 2 adults who were total care would be really overwhelming. But for me, it was not. And the reason why it was not is because I had a nurse, a registered nurse named Linda, show me. She taught me how to provide competent, safe care for the people that I loved. And she taught me, a 16-year-old, I was a cheerleader in high school, but she taught me the principles of nursing care inside of my home. And she didn't use any reference books. She didn't use any PowerPoint presentations. There was no simulations. She spoke to me. in very simple, easy to understand terms. She made me feel like I was more than capable of doing anything in the field of nursing. And so that's how I teach my nursing students. I truly believe that it does not matter who you are or where you come from, you can learn nursing. And the reason why I say that is because it happened for me. I am not just somebody who read a couple books or I'm popular because I'm in the in crowd. I'm not in the in crowd in the nursing education field. But what I do have, and that nobody can take it away from me, is my own experience. And so I put that into Read More Review. And the testimonials follow. I mean, like the testimonials show that it does not matter if you failed 5 times or if you failed 1 time or 10 times. If you are connected with the right tools, you can learn and you can pass. And so that is why I am the #1 NCLEX instructor in the world, because I'm working hard to show you guys that you can do it. I don't know if anybody else that comes on, I do lives twice a week. I do free NCLEX reviews constantly. I mean, we make ourselves available to you for your own improvement so that you can be a testimonial. I mean, if you look at the other NCLEX reviews and you can name them off, you're not going to speak to the owner of the company. You're not going to see the owner of the company. They're not talking to you. They don't care about the fact that you failed your exam. They don't care that you don't understand a certain level of information. They do not care to the point where they're going to make themselves available to you the way that Remar does. And anybody, I can tell that to anybody because I don't see it. I don't see it the way Remar Review gives it to you guys anywhere else. And so that's what makes Remar Review different in a nutshell. Okay, so thank you for the question. Congratulations, Mercy. See, I knew you guys were going to do this. You come on here. I passed my NCLEX after taking it 6 times. Okay, 6 times. You took the test. You didn't give up on yourself, though. That's what you didn't, right? You did not give up on yourself after 6 times when you had every excuse. You had 6 reasons not to try again, but you tried again and you passed. Wow. Congratulations. This is good stuff right here. This is good. So if you needed some motivation, we've had like 4 or 5 testimonials so far. Wow. We've had like 4 or 5 testimonials so far, just to encourage somebody out there. Somebody out there needed to see that even though you failed NCLEX once or twice, you are still in a great position. Actually, you're still in a great position. And you know what? One thing about NCLEX is that when you pass it, your patients will never, ever ask you, how many times have you taken NCLEX? They will never ask you that. It does not matter to them. What matters to them is that when you come in that room, you are able to care for them compassionately. You're able to care for them compassionately, and you treat them with respect and dignity. And most importantly, you know what you're talking about, because nobody wants a nurse that comes in there and has passed NCLEX because she just memorized a whole bunch of stuff, but doesn't have the heart for the calling. And so these are things that are most important when it comes to nursing. So we are NCLEXing right now, and we need to get started. So I was just saying, pass NCLEX, tell your story. It's amazing here. All right, so let's get into it. No, Shanisa, you need to stop it. She says, I'm looking for the owner. Y'all be looking for them owners with a flashlight. You will not find them. All right. Okay, so let us get ready for the NCLEX question of the week. It's a good one. Right off of our Instagram page. Did you know that Remar Review? Oh my goodness. Did you know that Remar Review had an Instagram page? Anyways, here it was. I liked it a lot. Let's look at it. Okay, so a client presents reporting abdominal pain, sore throat, and headache. The images are assessment findings by the registered nurse at the beginning and end of an 8-hour shift. Okay? Identify the abnormal assessment. And this is so important. Looking at the two pictures, what are you noticing about this patient? Let me see if I can bring it in for you. And I didn't want actual diagnosis. I just wanted you to tell me the abnormal assessment finding that you see, not a diagnosis, because we as nurses, we don't diagnose patients, but we are able to look at a patient, and based on our training and our knowledge, we're able to say, hey, from what I understand about anatomy, it is not cool what is going on. It's not cool what is going on. So the top is at the beginning of the shift, and then the bottom is at the end of the shift. And there's something just really profound there. And the correct answer is, did I see anybody? Yes, I think, okay, so Indira got it. Dilated pupil on the left side. Exactly. What I was looking for is the dilated pupil on the left side. And this is so significant because you want to let the doctor know. The yellowing around the eyes, to me, that seemed really localized, like maybe the patient was given a medication. Some ointments, some antibiotics have a color to them. So remember, when we are for NCLEX, it will be very, very obvious. Like if you're given a dynamic image or image, it will be very obvious the issue. And here, if we look at it again, you will see that that left eyelid, not the left eyelid, I apologize. The left pupil, what you have there is, can you clear that for me, Mark? The left pupil is going to be bigger than the right. So what's going on with this patient? You think to yourself, is this dilation, is it going to be reactive to light? What has happened? Something is abnormal. We need to let the doctor know. So that was our Instagram NCLEX question of the week. Let's do our Facebook question of the week. I loved it. Here it is. A female client presents to the emergency department with congestive heart failure. Now, upon doing a spiritual assessment, you know what that is? Upon doing a spiritual assessment, the client states that she is a Rastafarian. Which of the following should be included in the nursing care? Select all that apply. Right here for the Rastafarian client. Here we go. Which one's going to be included in the nursing care? 1, special prayer with a registered priest. 2, dietary consultation. 3, home medication assessment. 4, seeking alternatives to the standard hospital gown. Or 5, understanding the disbelief in the presence of a God. So these are the choices that we're thinking about. Do we need to add them to this Rastafarian client's nursing care? Okay. 1, special prayer times with a registered priest. 2, dietary consultation. 3, home medication assessment. 4, seeking alternatives to the standard hospital gown. And then 5, understanding that there is a disbelief in the presence of a God. Now, I see the answers coming in. They're coming in. Did you ever study this in nursing school? Was this ever a part of the curriculum, the Rastafarian client? I found it kind of interesting. The correct answers are this, PAP, dietary consultation. If you picked number 2, you were right. 3, home medication assessment, because these clients, they believe in alternative medicine. And then 4, if you have a female client, you want to seek alternatives to the standard hospital gown. The correct answer was 2, 3, and 4. Tyrone, you got it right. You did a good job. 2, 3, and 4. Tanya, you got it right as well. Indira, you got it right. Let's go over the rationales, shall we? Right now, 2, 3, and 4. A Rastafarian practices a special diet that includes no pork meat. Many may also avoid all canned and processed food. Way too much sodium in those kinds of food. A dietary consult should be included. Now, there may also even be requests for fasting, which means that the client decides not to eat at all during periods of sickness. Rastafarians are generally not advocates for drug treatment, So in that case, that just means Western medicine's way of treating conditions, they may or may not be down for, okay? Many Rastafarians believe that cannabis is a healing herb and included as part of a natural treatment plan. So you guys know cannabis is marijuana. So this is something that, even though there are certain ramifications to using marijuana here in the United States, culturally, other places, I get you use it. So understand that it could be a part of the Rastafarian's treatment plan. All right. Also, women who practice this religion dress modestly and may feel the hospital gown is too revealing and refuse to wear them. So you would definitely want to have an alternative to that hospital gown. And the Rastafarian does not seek religious counsel from a priest. So that would not be included. They don't seek religious counsel from a priest, but they very well do believe in there being a God. So they don't not have any connection, or they don't believe that there is not a God. They actually are very spiritual people, and they do believe in God. So that was just a question, and it's a select all that apply question. So literally there was really no strategy that you could use for this select all that apply question. You had to just know the content. You had to know about Rastafarians. You had to know about this culture of people in order to pass it. And so this is why I stress content so much. I stress content because for the NCLEX RN exam and PN exam, you will get a lot of select all that apply questions, and you have to know about the subject if you want to get them right. If you know about the subject, then select all that apply questions are quite easy. So some of you may have found this question to be quite easy because you understood the Rastafarian client. Now, I stress content here at Remar Review. So speaking of content, guess what I have to show you guys? Our favorite 7 days of NCLEX is coming up. Oh, it's so close. I'm like so excited for it because 7 days of NCLEX, you are going to experience Remar Review 7 whole days, December 26th, all the way until January 1st. We're bringing in the new year studying NCLEX. Also, one of the great things is that for the DVD self-study package, there will also be an amazing discount. We will have a code for that whole 7 days. It's going to be great. If you guys don't know about 7 days of NCLEX, it really has a life of its own. And nursing students email me about 7 days all year round. They hear about it when they meet Remar Review. It's usually later in the year, but they've heard about 7 days of NCLEX. And it's a live event. So we don't show this but once during the year. So if you're here, this is great because you will get to experience 7 total days of NCLEX reviews for free, and you'll get to do it live. So for you guys to remember, it starts the day after Christmas. And if you signed up for it, you have already gotten your workbook, which you need to print out. It's 30-something pages. It's 30-something pages of information that we will be going over, all content. It starts at 8 p.m. Eastern time on the 26th. Now you want to sign up not only to get your workbook, but to get the schedule, okay? Because every day of the 7 days, the times vary. So to make sure that you're present and you're here live, we are going over day one. We're going to do some NCLEX questions right away. We're going to do some critical thinking test points. Day two, we have hot topics for NCLEX where I'm going over those topics you cannot miss before you sit for the exam. Day three is our pharmacology review. You have requested it. So it is coming. I'm going to be talking about drugs and their interactions pertaining to safety, which is the most important. And we're going to go over some pharmacology teaching points, some easy ways that I remember a lot of medications. I'm going to be sharing that with you guys. Day 4 and 5 actually will be the full-on content review. And we're going to go over, as you requested, psych issues. So we'll be going over psychology for NCLEX. We'll be going over, oh my goodness. Yes, I'm going to dig deep down into the psychology and make sure that you understand it. Also, we have some pediatrics and some priority. Day 6 of 7 days of NCLEX will be our homework review. If you have the package, you know that in the package, there are homework questions that you can start doing right away, and just to see. It's up to you. If you want to wait or if you want to do them. Some people are super excited and they just have done all the homework. I saw people filling out boxes already, even though I've given them no notes. They're already filling out their workbooks. I get that you guys are excited. If you have not registered, there's a link on the Facebook page. Also, if you go to remarnurse.com, again, remarnurse.com, you will be able to sign up for 7 days of NCLEX, totally free, right here on Facebook. And the final day of 7 days of NCLEX will be our live NCLEX open house on January 1st, which also happens to be New Year's Day, which also happens to be 2019, which also happens to be Mark and myself's wedding anniversary. And we will be spending it with you early in the day. And we will do our NCLEX open house. So we do some amazing things. We give out information. We also do free giveaways. And I mean, honestly, it's going to be great. I don't even know all that we will do, but it will be very fun. So don't miss it. 7 days NCLEX. It only happens once a year during the holiday season. And right now is the perfect time for you to join in to do that. All right, let's get into some more NCLEX questions, shall we? Which tasks should the registered nurse delegate to the unlicensed assisted personnel? Which tasks should the RN delegate to the UAP? Here we go. Number 1, check the oximetry. Check the oximeter reading for the client in respiratory distress. Take a blood sample to the laboratory. 3, obtain the vital signs for a client during an anxiety attack. 4, assist the healthcare provider with a thoracentesis. Which one is the UAP most appropriate to do? Check the oximeter reading for the client in respiratory distress. Take a blood sample to the laboratory. Obtain the vital signs for a client during an anxiety attack. Assist the healthcare provider with a thoracentesis. This is not a select all that apply. Commit to one answer. You got to learn how to commit to an answer within a minute when you're doing these questions. All right, I see the answers coming in. Great job, everybody. The correct answer is POW. Number 2, you guessed it. Take a blood sample to the laboratory. This is what you want the UAP to do, because of the other choices that are given, you got to pick the best one. And if you look at the other choices, well, these clients all seem to be a little unstable. And these clients seem like they would need an evaluation, some assessment, some education. So number one, the client in respiratory distress, we are not going to have the UAP helping this client at all. The client with an anxiety attack, the UAP may not understand the principles of how the client will respond when somebody is trying to take their vital signs. That's not going to be a good task. And then 4, absolutely not will we have someone without a license assisting with a diagnostic procedure, especially an invasive one like a thoracentesis. Oh no, that's not going to happen. So I got this question. It's a really good one. Some of you guys might be interested. Oh, I get this question so often, so I had to put it on our Ask Remar segment. It says, what is the goal of the interdisciplinary team? Oh my goodness. Have you seen this? Have you seen this question? I got so many of these types of questions that when I wrote the NCLEX Ready Question Bank book, I included interdisciplinary team questions because I know that there wasn't anybody else talking or teaching about this subject. So for you guys' learning pleasure, interdisciplinary teams are super, super important for the client because what they help to do is they help to prevent complications. So when you see these type of questions on the NCLEX exam, think in your mind, who is most important to prevent this client from having a complication? So let me think in myself. If you have a patient and they're being discharged, let's see, not even discharged. If somebody is in the hospital and they come in and they have diabetes, they have a history of smoking, and they also have congestive heart failure, NCLEX may say, who needs to be on the interdisciplinary team? So you think to yourself, this is a patient with several comorbidities. They have diabetes, they have a history of smoking, and they also have congestive heart failure. Who needs to be on their interdisciplinary team? It is going to be the registered nurse, okay? How can the registered nurse help prevent complications? She is going to administer all the different types of medications appropriately. She's going to educate the patient on how to take their medications, right? Another person who definitely needs to be on there is going to be the healthcare provider, the doctor, because he's writing the orders for the medication. Another person would be the pharmacist. How can the pharmacist help prevent complications? Somebody with several issues will be expected to take several medications. The pharmacist is so important because of the possible drug interactions, okay? The dietitian, exactly. The dietitian is going to be helpful because the patient has what? They have diabetes mellitus. So also respiratory therapy because the patient has congestive heart failure. They'll probably be on oxygen. So this is how you will think of interdisciplinary team members. Who's most important to help prevent complications? All right. Yes. So I hope that helps you to negotiate them when you're thinking about them. This is how I think about them. Also, if you want to do practice questions, then also the NCLEX Ready Question Bank has those kinds of questions. This is Let's Talk NCLEX. So we're just talking NCLEX. Let's move on. Question coming up right here. The nurse is caring for a client diagnosed with multiple sclerosis. The client tells the nurse, "At home, I'm having problems going up and down the stairs. Which intervention should the nurse implement first?" Again, here's the scenario. The nurse is caring for a client diagnosed with multiple sclerosis. The client tells the nurse, "At home, I'm having problems going up and down the stairs. Which intervention should the nurse implement first? Here are our choices. Number 1, determine whether the client has grab bars along the stairs. 2, encourage the client to avoid the stairs. 3, initiate a referral to a physical therapist for the client. Or 4, discuss whether the client takes non-steroidal anti-inflammatory drugs. What is the first thing that the nurse should do for this patient? What is the priority of the nurse who has a patient who says they have difficulty going up and down the stairs? This is the last question for the weekend. Give it your very best answer. Give it your very best answer. I see 1. I see number 4. Lots of different choices. What is the most prudent thing and the safest thing for the nurse to do? You guys can do it. I know you can. I believe in you. I believe in you. Okay. The correct answer is going to be number 1. Congratulations if you got this question. It was kind of a tricky one, but you need to determine, the registered nurse should determine whether the client has grab bars along the stairs. And this is very important because it will allow the nurse to know the safety of this patient. If they're having trouble going up and down the stairs, we don't want to tell them stop using the stairs. We don't want to tell them stop using the stairs. And we don't automatically want to send them to PT when we need to do our nursing assessment. We should do our due diligence before sending a client to someone, because if there are assistive devices along the stairs, then that can help. But if the patient doesn't have any assistive devices along the stairs, then the nurse can suggest improvements of safety in the home. So did you get that one right? A couple people got it right. Good job. I know safety always has to be. If you didn't get it right, it's okay. But you have to remember, safety is a priority. And the good thing about questions, although questions really don't teach you anything, they do help you to identify weak areas in your knowledge. So it's okay. You learned something. And I always say this, I would much rather you get questions. I would much rather you get questions wrong here than when you're actually taking the exam. So let me see. Oh, I have another question. I'm going to do it. I thought that was the last one, but it's not. So shall we continue? Let's go. The nurse and licensed practical nurse have been assigned to care for clients on a medical unit. Which nursing tasks should be assigned to the LPN? Which nursing tasks should be assigned to the LPN? And so the wording of this question was really interesting because look, it says the nurse and licensed practical nurse. So when you see these two delineations, you know that the nurse is a registered nurse, and then you have an LPN working together. So which nursing task should be given to the LPN? Number 1 is administer PO medications to a client diagnosed with gastroenteritis. 2, take the routine vital signs for all the clients on the medical unit. 3, review the healthcare provider's progress notes. Or 4, assess the urinary output of a client diagnosed with kidney disease. Oh, you guys got it. You guys got this one. Before I could even finish it. Oh man, before I could even finish it, you guys got it. The correct answer, you guys know this. You know what? One of the things, let me give you the answer and then I'll go into my rationale. Here we go. The answer, administer PO medications to a client diagnosed with gastroenteritis. This is going to be the most appropriate thing for the licensed practical nurse to do, because remember, share this video too if you have international nurses, because a struggle of my international nurses is that they don't necessarily have the delegation processes that we do here in America. And so they're not necessarily working with licensed practical nurses or unlicensed personnel. So remember, if we're looking at the choices, the licensed practical nurse always gets the stable patients with expected outcomes, okay? They are able to get the stable patients with the expected outcomes. So if we're looking at the choices here, and remember, we want to pick the best choice out of what we're given. Some nursing students love to get caught up on, well, it should be this, or it should be that. But don't worry about that. Focus on what's in front of you and pick the right answer. So if we look at number 2, what's wrong with number 2? Take the routine vital signs for all the clients on the medical unit. What's wrong with that? We're talking about a licensed practical nurse here. We would not have somebody with a license doing vital signs only. You know, that's something that an aide can do. We would not have someone with a license giving bed baths or getting someone dressed. Like, these are not things that someone with a license should be doing. So you wouldn't pick that. Yes, that's for the unlicensed assisted personnel. All right. Review the healthcare provider's progress notes. Well, no, that is not going to be the most prudent for the licensed practical nurse to do. It is going to be very time consuming, and it won't be patient specific here. So of all the things that we could have our LPN doing, we're not going to have them reviewing the progress notes. Okay. That's more of an RN task. Okay, so Nancy, this may be an easy question to you, Nancy, which is good because that means you understand scope of practice. But I know for some of my students, this is a tough one. All right, number 4, assess the urinary output of a client diagnosed with kidney disease. And absolutely, the LPNs are not able, although they are very knowledgeable, although they have a wonderful training, and I've worked with some LPNs who are honestly can outwork any RN. However, they just have a limitation of their actual training, so they would not be able to assess that. And I think we have to understand this, but we also have to be able to delegate with dignity. So if you're an RN and you're working with the LPN, don't feel like that they are a lesser of a nurse, because they're not. They're working within what they've learned. And there's a lot of issues with, there's a lot of issues with the dynamics between registered nurses and licensed practical nurses. And I want you guys, I want REMAR nurses to be different in the way that we work with our peers. And so registered nurses are not better than licensed practical nurses. Registered nurses, I will say it again, are not better than licensed practical nurses. It is not so. What we do have is just an advanced level of knowledge. That's all. But if you put us side by side, both can provide very compassionate, knowledgeable care to somebody who is sick. All right, that's my hobby horse for today. So the correct answer is administer PO medications to a client with gastroenteritis. Well, guys, I won't hold you any longer. It's Friday. I had a wonderful time here today. I wanted to get on and remind you guys about 7 days of NCLEX because it's coming soon. It's coming soon. I need you all. I know that you may have many questions for me, and I know you guys are emailing me every day, and I appreciate the connection and all the stories that I'm reading. Honestly, it takes a great deal. It takes a great deal of our heart and our desire to really connect with you guys on a personal level. So if you have any questions, this is my email address. Please use it. Please share it. All right. support@remarreview.com for any questions, concerns, comments. We also take prayer requests. Here at Remar Review, we have Elder Mark Callion, and he prays for us. He prays for you guys. He provides us our spiritual nourishment, which honestly is supreme over nursing content. So, and all of that, I have to end this broadcast in our typical manner is bam. We can, we will, we must pass NCLEX. We can, we will, we must pass NCLEX. Happy holidays to you guys. Enjoy the holiday season. If nobody has told you this, you are extremely blessed. You have so much to be thankful for. You have so much to be grateful for. And today is a new day that you have never seen before. So enjoy it. Enjoy it. I love you all. Have a safe weekend. Guess what? I'll be back for Monday. It's Christmas Eve, but we still need our Christmas Eve Monday motivation. So check it out Monday. Look at the Facebook page to check out the time that I'll be going for Christmas Eve. It's going to be really awesome. So I will see you guys there. Have a great weekend. We can, we will, we must pass NCLEX. Merry Christmas.